So I've known Dr. Lüder and Dr. Devereaux for almost 20 years now. They have been involved in the program at epilepsy surgery ever since I really have been in training, and I've learned a lot from them. You know, it'd be really difficult to overstate the tremendous impact that both of them have had worldwide in the treatment of epilepsy.
That almost every patient you see, you can help and you can make an impact on the patient, which is not true for many other neurological diseases, particularly progressive neurological diseases, where you stand by just seeing how the patient continuously deteriorates. You can reverse the process.
It is an area in which a significant percentage of patients can be helped, keeping in mind that epilepsy is a symptom as much as a condition. It's a symptom of a disturbance of the neocortex of the cerebral hemispheres largely, and that may be genetic from childhood, or it may be acquired due to a problem that impacts the cortex, the neocortex.
The conception of epilepsy as an anatomic phenomenon, one which is associated with the zone of epilepsy that's responsive to surgical treatment, we take that for granted today, but it really started with these two people.
These days, epilepsy surgery in many of those cases can eradicate the epilepsy. However, the psychosocial problem remains, and that has to be resolved. And in that sense, the Epilepsy Association makes a big job and is extremely helpful, or let's put it in other words, indispensable to really bring the patient back to a normal life.
Aspects of epilepsy, particularly in patients who are socially disadvantaged or have other neurologic issues, such as cognitive issues and what have you. This is where the Epilepsy Association, in a sense, takes over, if you will, and can take the next step to getting patients that we can help to varying degrees medically, and then they can help integrate the patient back into society.
When you think about what a patient wants from their physician, from a clinician, they want somebody who's kind, who's patient, who's extremely knowledgeable, but also deeply compassionate, and cares about them and knows what it is that they need in order to get better. And I think that really describes them very well. Well, I think it's fitting that they received the award again after so many decades. The definition of legacy is someone who's had a sustained and long-term impact on the field. I can think of few clinicians in any area of medicine that I deal with for whom this is more true. Dr. Lüder and Dr. Devereaux, congratulations on this award. I can think of no one who's more worthy of it than you are.
Congratulations, Mike.
Well, it's obviously a great honor. And because it's an organization we care a great deal about, and so to be recognized by that organization. There's been a lot of very good neurologists, epileptologists that have been honored in the last 30 years. So I look at this as an award for longevity. But why are we still hanging around at advanced age? Because we really like what we're doing.
Yeah, for me it's really a very special honor. I greatly appreciate the Epilepsy Association for giving me that award. And one of the reasons is that I personally have been much more involved in the direct treatment of the epileptic patients, as opposed to the more psychosocial aspects. Doing my job as a diagnostician and doing research in epilepsy. For me, really very, very meaningful. The fact that the epilepsy recognizes what I'm doing, even if it is somewhat outside the field of what the Epilepsy Association is doing.
Success in epilepsy neurology really requires somebody who has an encyclopedic knowledge of epilepsy, who has a tremendous attention to detail, but at the same time has a deep level of compassion. And I think that describes them very well.
Well, once again, I'd like to conclude by thanking everyone who is at the gala and supporting the work of the Epilepsy Association, because needs of patients with epilepsy will probably never fully go away, and it will be important to continue to support the work of the Epilepsy Association.
I'm also very grateful to the Epilepsy Association for this honor, and it is particularly great that this honor goes to both of us on both occasions, and after 30 years, I suppose. That is really very exceptional, and I greatly appreciate the honor.
So, and we, after 40 years, we still like each other.
Well, that is what he says.